Hello everybody, this is Viren from New York City, and I wanted to bring to you a review of this month's edition of CHEST from February. I'll start with the science. The best one that I felt was the study describing role of inhaled corticosteroids in fracture risk in patients with COPD, and it mirrored the results of the original lung health study. They looked at 8.2 million people, so it's a good population trial, and showed that the fracture risks increased at 4 years. Now, this is important because we need to make a better push as a pulmonary critical care community to take out inhaled steroids in patients with COPD instead of keeping them on it unless there's a specific indication. The CORK trial was interesting to read because it describes early and sustained improvement in ultra-low dose CAT scans in patients with cystic fibrosis who are on treatment. This mirrors the improvement in inflammatory markers, symptoms, as well as even Pseudomonas microbiota in these patients. Now, I thought this was interesting because in any chronic disease, an ability to monitor progression or improvement adds a huge tool to the treating physician's armamentarium. With that, I come to the partners in healing piece, and I found this very interesting because in the environment of interprofessional care that medicine is heading towards, and that is super beneficial for our patients, this actually sheds light on how involving patients' families in their care post-operatively reduces the amount of admission. In fact, the Partners in Health article was instrumental in boosting the social media shares for this month's CHEST. Talking about social media shares as part of our ongoing study, we see that there were 195 social media mentions just from the February edition of CHEST as of March 1st. And in fact, the only continents that are not represented on the social media spread for this month's edition are Antarctica and Arctic. So I think we're doing great, and similarly this month's edition of CHEST was amazing because with all these high amplitude research articles, you also had a little corner of reflection in a piece that was written about the daily life of an intern, and it struck home with me because we need to think about this often, and ultimately we can give a better training environment to our trainees. The New York City skyline right here. It's well presented, it's iconic, and I thought the same held true for the CHEST edition. The font is easy to read, the colors are complementary, easy on the eyes, and also what's interesting was that the app was very fluid and easy to use, did not require multiple sign-ins, was easy to link with the articles and download, and I appreciate that because it makes my life easier as a user. I thought that the servings from CHEST this time were very gourmet, very much like the restaurant scene in New York City. You had the giants in their field, the thought leaders, Dr. Feller Kaufman, Dr. Ost, Seth Koenig, Dr. Ivashnia. And these are people that are changing practice every day, and having a chance to read their opinions and thoughts, it goes a long way. This is one, creating visual abstracts for the main studies, and this does not only have to be research. This could be, for example, the Partners in Health article. I feel like that would reach a wider audience. The thing that I really feel strongly about is involving the article authors and bring them on to Twitter and Reddit as part of a moderated Twitter chat, a little bit like Journal Club, but it could be more of a back and forth or their perspective on their own work. I feel this is one of the ways in which we can talk to people and have them ask the creators what they think about their creation. Besides this, I do feel that the social media team at CHEST has done a phenomenal job throughout. I do enjoy working with them, and I hope that I can act as a bridge or a liaison and continue to have CHEST reach greater heights, both the journal and the organization.